kan Janai shu ia ka Jingshakri jong ka Dr. H. Gordon Robert Hospital. Kawai na ki hospital ka balarimba ha ka than cha te lammi ngi kari. Menta ka arpu khanai terik unai wing ka Ktiew EMS Trust UK lingbai kongsi kharsintiw kala ai sngoba ya ki tiar ai jingsumar ki bai dei ha ka bakha khulung bat ka jingkwa jingkya ki kinthai lane ka obstetrics bat gynecology operation theatre department. Ya ki tiar ai jingsumar ki basongdor palat lai pusan lak la palat menta ka singi ha ka jingalang bala penlong ha ka office jong ka governing board jong ka hospital. Ya kini ki tiar ki bala ais ngom ha sha ka hospital la odriban da uba Michael Carcentio uba de uksiu jong iba Synñiang sungobha ya kini ki tiar ki tar sha ka hospital. Habakran kumukongsan uba Michael Carcentio la ong ba ka ka hospital ka longkum uding bilad uba la yang scam habdeng ki jing e ba jing tenju ki babon ban a Jingshakri yo pat lang ka jalla nadu ki baduk hadu ki bakhambyang ka yo ka kodru. Ula omru ba ka hospital ka pliru ikilat yo kam ya ki samla ki bala pendap ya ki jing puli ki bayadei bat ka kwat ki kya. Ula ya ru ya ka jing along ka wei jong ki nong trei jong ka hospital nadu ki nong pun khu jong ka hospital hadu ki doktor ki basumar ya ki nong pang bat ki wei ki badan benta ban penyat ben ya ka shalentem shakri jong ka jaka sumar. Ya ka ka jing alang la penyat du uba KW Marbanyang ubalong u administrative officer jong ka hospital balayo e ka jingkren na u Dr. Arnong Rum ubalong u medical superintendent. Layo e ka jingkren lingkot chapang ka project de i Dr. Mercy Shalla ibalong i specialist jong ka tanat obstetrics and gynecology department jong ka hospital bat layo ru ya ka jingkren na u Reverend SS Majau ubalong u chairman jong ka governing board.
Yaka ladau try sumar ya kanong ba kanong up upay lenoi kapal lenoi ba pinkhit ya master ba pinpet mit kata ban ba mi ku ka jing trashitam na ba kumta upinyot ya ya ki ba ye ju ba da ka kita ku jing ken kumni utrai ula krenru how Moses uda ong tu kren how Aaron bat haki kun shinrang jong u da kabaong kumni pinkerku yaki kun Israel da kabaong haki utrai unda kerku yami bat unda suma yami
kena kalian kejonga tadi ke afternoon ke panggilan kedua sesisin naik kublai way di badan mentah kena kesini nala wanra lo ya kubor jong kejing ai kublai na kayeng kesam kejongi bat na kalian kejongi leye di dalam cita siapa ripilat bat bangi yai don kita commitment bat kini ke hospital bat ki projects okay jong kini ke hospital na try mentah kene ke second last day jong 9 November 20 days from now we will be celebrating Christmas. So it's such a lovely time. By kini Tiar New York inaugurate having a season kabala delpa kata kabang niong ka Christmas. So we take this as an opportunity bakalong kung ka kinja Christmas gift kaba nagaliang jong ka trust ni ai ya ka hospital. Abang pwede gani ka program tentang sini ngawan ang ni ba email the kadang teamwork jangan macam email. From time to time, we try to convince, we try to explain. Ya, email kita berani setai. Ya, ki milestones kita bak hospital aku akan achieve. Ki milestones kita bak hospital aku akan pendap. Ngadi beri ubaret, ngadi samla berang bersang ban struggle in life to come up in so many ways. And I'm very honored na sekolah semungu adu kata bahawa bikot yang amat asing ku chief guest. Ndrai naku abanong tangkawai chief guest hakani ke program te nasngo ide ima MS juni and a team up with ima IO. Namar kidai kini kibaman man kapol kijupun ini kijukli ilong kumno imingit idon iklan nanta kiju express pat ya kijing don kam jong hospital. So ke effort but ke reach out ke bagi ki le man kapol kata kapelong iki bagindai kita kibriu ki ba shim ya ka responsibility ban penyeng ya ka hospital ban pelong ya ka kumakalong munta hagani kesni tolong kesni ka kerpang kani ka donation ka papoi hagani kesnam 2022 23 24 kat kom KFC area ka dei 35 lakhs plus or minus nang tamo de kani ko mansu pen kemau yang sesisin kare ka continued jong ketu ka jong kumang aju continue biang kani kadai kajing sedang bakajing continue ya ke donation ka pelapoi hagani ka hospital hagani ka trust tolong kumba lai krore but kumang nila ngalong mane ko sedang ka dedication yang kani ka trust kalong bai i banyai continue na kapor sa kapor manakani hapor bingi rakhi ya kajing nap si spots dem ka hospital ngaku samla ngaju perkat makani hospital ting-ting kalau kemudian pilat nomor ba we have faced so many ups and downs ngabon ki jinge ki ba hospital kaya tendu but kejudan ru kapor ka ba ki briu ki bawan hangni lesi ki ha banik phaino nomor ba kimbiang ki tiar ani kimbiang ki equipments nak tak daw ni dan kita ka continuous effort nak kalian ke jumi bakum nu nginyai upgrade ya kita kam jong kani ka hospital kajing dan kam jong hospital bunsian kam dei than tam Ktiew hababi ya celebrate ya centenary menagani kajing dap sis pasnem new ya ka teamwork ka ba each and every staff each and every member jong kani hospital ki ya ai namanta ban pendak ban pelong ya ni ka program ka belum successful ngas no balong baki institutes ki balong ka bahe kum kani ka Dr. H. Gordon Robert Hospital lade ka we ka asset apo ka state ka jomi ka ba lesi da ka jingdon jang kani ka hospital kam lade tang kata ka bakin ai ka jing sumar lalong ru ko we ne ki chaka ka bakin generate employment bakan ai ya kata ban ref ya ka status jong ka state jomi ha ka healthcare ha bang snap ya ka jing ai ka report ha ka tugas ni ka bangi le ya ka closing ceremony niyo snow ya ka history jong hospital but ka teamwork but ka dedication ka ba every member nadu kinong pengkod kinong sar ki doktor ki nurse ki staff ki briu ki betre ha ko ki hospital dolo ki badan ha kani ha ko hospital along ka eke ka bangi ni dei ban so sarong ban ni dei hiru banyai long ni banyai Ktiew ya hospital Syahmat na hakani ka program kitho ru ya kawe ka association ka bangidan ako hospital kumu proprietor jong ka canteen abang ngajusong ako canteen jong hospital ngani tu ipi mangi ngilong kum kiriu pat ba kum ki buan sim gawai nang ni nisong hante ngi akendu ya ki customers lani ki patient lani ki knock up jong ki patient na kapor sa kapor abang ye fundo iki teng kumusam lang abang i ngasno balong bat bangan batay ya ka jingi ka jungi kalong ba ki briwi hapo kani ka state ka jungi hamtam na ki thai nok kendong kidang don ya ka confidence hagane ka hospital kidong ya ka jingsanya ya kani ka hospital pinalet si ki thai nok kendong pinalet si ki jaka ki bakham janai pini batang sulong ya kata ka kentin robot hospital kidong kata ka sigum ya ka mensian ka joki teng ko malaong no tang halenti na yosno pun le tiak sorobal ajam ba namar ba kidon kita ba kadai hospital jong kanyam ngasmo banten kemau ya ka jingkren ha ka tugasni jong ka closing ceremony jong ka centenary ka ba iwe ni nong kren yong ya gitu kentin ba ka Jingsumar ya ki brio kalong kawai ni ki ministry kapag ya ki kintin ba ka Jingsumar ya ki brio kalong kawai ni ki ministry kapag ublay labo tayo makani kapor ka ministry ka jong ublay. So everyone who is involved in this hospital, we are following the footsteps jong ublay mo kapag ublay ula ay ni mata kumno bangin Shakri pat ya ki para brio ti nakatagadaw Nashimi gini kalat, but congratulate your hospital. Haban ni celebrate birthday, ngaso bonengi susi namar ba daladap sisnang ngila nang rangba ngila nang temen. Mereka hospital pat katba ka celebrate ya ka centenary. Kana ngide ban semua kemen. Namar balai ninang yai penim, ninang yai thang ya ka syarak jo hospital, ban ninang yai ra ya hospital. Nagawai ka jakas koi pot, nagasnam siya kasnam. Kung mga juang man kapor, all is goal. Kani ko hospital sisa kadai kata ka goal naman ta ka healthcare aga state ka jongi. Nga ko musamla bon kijing ya ki kam ki bangi tray, ndray ni don ni ka commitment. Kumno bangin yai Ktiew ka hospital sakmat, kumno bangin yai upgrade ya hospital bakana ban modernize ya equipments bakana ban ya compete bakane ka health environment ka badan po ka state ko jongi ban ai ya ka healthcare namun ta longyeng ki wan na longyeng ki beduk bagi ba Kham jenjar bagi nyo ya kata ka healthcare kumbalong nam ki private hospital ki badan ha kani ka state ko jongi agi kentim ki ba khado ngasno ban ong ban yai warra ya kata ka commitment sa sisin nagaliang ka trust nagaliang kayeng kesem ko jongi baha kanu ke jingdon kam jong hospital kinu ki effort kumba ka julong nai i medical superintendent i maio i pastor bat paro ki bajuan don hange kinu kita ki bapi pi don kam ni kum ke yeng ni sem ya kata kala bakat bala ni nyai don rekat bat kane hospital nai kublai ngadu komensim ya hospital ka bala sem ya kane ka opportunity ban pelong yang kini ke program ban kumjuru ke balasib yang kini ke lat ban pediang yang kini ke terwa nak kalian jong keteras ke jongi iwe doktor iban penangkam yang kini ke Tiar ki medical professionals ki ban penangkam tong yang penangkam nak mensim of gratitude ya ublay ban mensim jong kemen bagi priu ki ba ay kini ke Tiar ki deibet ki batray nadu ke mensim nak umsep ke jongki ban nak jing trace tong ki pelang ban gesngi ban yo ban lum ban lang habakut usnam nani habakut ka financial year jong ki kat baki don kat baki la ka bot ki pha sakane ka hospital namta ka healthcare namta khamtam ka maternity care ka mod namta ki long tume tang gini ki kentin ku play ya ki nong penya jong hospital ya ki principal, nursing superintendent, matron, ya paro kebetulan ni, doktor, nurse, staff, kinong penyat, jong ka KGP assembly ke jong ni, ki pastor, kinan basan bar paro kebetulan ni, ki ba la nakapor sa kapor, ban Ktiew, ban dekat, bahkan ni hospital, ban monitor, ban guide, ya hospital kumno bahkan yang IQ nakapor sa kapor. Tang kita ki Ktiew, kublesibon nakaliang kayeng kasam ni. Nakaliang jung email ba nakaliang jungi ni kular sa sisin bangin ngay don ke dedication na mata ban upgrade ke hospital tang ta ko baseball
brief report of project leader to receive Shalad and specialist of Synñiang but it's in Kham like GS action sesisin dan sekarang baru ketika report akan naik dalam GS report juga dalam ini.
The first one is the cardiac monitoring with wall mount. It is an advanced monitoring system for the patient, giving us a real-time insight to the cardiac health of the patient, thus ensuring us a timely and precise intervention whenever needed, therefore helping the patients. This is keeping it in the labor room. And the next is the cardiac topography or the CTG machine. You all know it's a boon to the maternal and the fetal health. So having one is very good for us. So it actually helps to monitor the fetal heart, and a uterine contraction of the mother and baby. So any deviation from normal again helps the healthcare professionals to take immediate intervention and improving the outcome of the mother. This is a syringe infusion pump. We received 4 of it. 2 is we're keeping it in the maternity ward and 2 in the labor room. This is a very reliable and precise instrument wherein allow us to deliver with controlled drug administration. So thereby reducing the risk errors of administering drugs, thereby improving the treatment outcome for the patients. This is a radiant warmer. So this is actually a crucial addition to the neonatal care unit, wherein it provides an optimal temperature regulation for the babies. With the adjustable settings or heat settings, it's easily monitored and therefore improving the outcome of the neonates. This is an eclampsia bed. It is placed in the labor room. We have a special room for the eclamptic patients. This bed is actually dedicated for such patients who actually experience eclampsia. They require close monitoring. So this bed is well equipped with monitors and supports so that we could monitor the patient. This is an OT bed, mainly assigned for us OG department. So this is a versatile bed wherein we can perform many procedures, surgicals, depending on the need of the surgical procedures. So it is adjustable settings and then the control is very helpful for the patient as well as for us. Next is the diathermy machine. This is again for the OG. This instrument is helpful in various surgical procedures. It's commonly used for cauterizing or cutting of the tissues. So this machine actually helps us because of its precision. It helps us to reduce blood loss in the patient. It also helps in faster recovery of the patients. So benefiting them. And next we have the cubicle track system. This is actually installed in the ceiling where it actually supports shields and curtains like this, providing an individual space. In our health setup, we put it around the patient's bed in order to provide, offer them a private privacy corner so as to do any medical procedure or test. And these are the 2 that have not been received, but we are still intending it. So one is the shaker. This is used in the milk band. This it's like a pasteurizer, not the conventional type, but it's a water bath type, wherein the milks are pasteurized so that it can be used. And the next is the ureteroscope. This is a flexible and slender device which actually help the surgeon to navigate and examine the urinary tract system. Especially it's useful for us. Why? Because some of the patients who are antenatal, they may have renal stones and everything. So it's very good for a surgeon in order to avoid any other complication during the antenatal period while they're doing the procedures. It helps in proper diagnostic as well as it can provide a minimal invasive procedure can be done in order to give a satisfaction to the patient. So that's it.